All right, today we're unpacking a really significant shift happening in Abu Dhabi's healthcare system. It's a new reimbursement model called ADOC. And believe me, it's set to completely reshape how outpatient care is managed, paid for, and delivered.
So, here's how we're going to break it all down. First, we'll get into why this change is even happening. Then we'll explore the big idea behind it all, this concept of value-based care. After that, we'll properly introduce the ADOC system itself, see how it actually functions in the real world, and finally, look at the timeline for rolling it all out. Okay, so first things first. Let's tackle the most fundamental question. Why bother? Why go through all the trouble of changing a system that's been in place for years? What's going on that's forcing this kind of reform? Well, it really starts with this one pretty startling number. 11%. That's the forecasted jump in medical costs for the UAE this year alone. Now, to put that in perspective, that's more than 5 times the general rate of inflation. You can't have a system that's sustainable when costs are skyrocketing like that.
So where is all that pressure coming from? Well, it's not just one thing. It's kind of a perfect storm. You've got a population that's aging rapidly. The number of people over 65 has literally increased tenfold in just over a decade. With that comes more chronic, non-communicable diseases. On top of that, people are going to the clinic more often than in many other parts of the world. And here's the kicker. The old system, fee-for-service, actually rewarded that. It paid for more services, not necessarily better health.
So if the old way is broken, what's the fix? Well, it's all about a massive shift in philosophy. It's about moving away from paying for the sheer volume of things done and toward paying for the value of the care the patient receives. And this isn't some random idea that just popped up overnight. Abu Dhabi has been on this journey for a long time. They already reformed inpatient hospital care way back in 2010. So tackling the outpatient world with ADOC is really the next totally logical step in this bigger long-term vision.
So what does this volume versus value thing actually look like? Let me give you an analogy. The old system was like getting a restaurant bill where you're charged for every single item, the napkin, the fork, each slice of bread. The new value-based way is like paying for the entire meal as a single experience. The focus isn't on the number of items, but on the quality of the meal and whether you left satisfied. It's about the patient's whole journey.
And this whole transformation isn't just being made up as they go along. It's built on a foundation of really clear principles. You can boil them down to a few key promises. Always put the patient first, make sure payments encourage high-quality results, keep the whole market stable by sharing risk fairly, and, a big one, make the whole process less complicated and bureaucratic for everyone.
Okay, so now for the main event. Let's pull back the curtain on the engine that's going to power this whole new value-based model, the Abu Dhabi Outpatient Classification System, or ADOC.
So, what is ADOC? In simple terms, it's a whole new language for classifying outpatient visits. Instead of billing for every single little thing, it uses a clever shortcut. It assumes that the specialist you see, like a cardiologist or a dermatologist, is the best indicator of what your main health issue is. It focuses on the patient's condition, not the list of procedures.
And the core unit, the fundamental building block of ADOC, is what's called a service event. Basically, just think of this as the entire visit, the whole shebang. From the moment you walk in to the moment you leave, as long as it's a real clinical interaction that gets written down in your medical record, it's considered one single event. That's the thing that gets a single price tag. Now, you might be thinking, wow, that sounds like it could get really complicated. But here's the truly brilliant part. It's designed to be simple most of the time. Just look at this data. A whopping 93% of all outpatient visits are actually very straightforward. They either involve just one main activity or a couple of related ones. This means for the vast majority of cases, the system works without needing some super complex, confusing software. The entire system is neatly organized into 4 main groups. Think of it like a pyramid, based on how many resources are used. At the very top, you have the P series for procedures, things like minor surgeries. Just below that is the C series for specialist consultations. Then you have the S series for support services, like physical therapy. And at the base is the D series for diagnostics, like lab tests, which are designed to just get bundled into whatever else is happening.
All right, so that's the theory. But what does this actually look like on the ground? How does it work for the people who have to use it every day, the coders and the clinicians? Let's get practical. Okay, let's follow a patient's journey. Imagine you go see an ENT specialist for a checkup. That visit starts out classified as a C for consultation. But during that same visit, the doctor decides to do a nasal endoscopy. Because that's a P for procedure and it's higher up our pyramid, the entire visit gets reclassified to that higher level P code. Now, what about the CT scan and blood work the doctor also ordered? They just get bundled in. See? One visit, one primary activity, one code, and one payment. Simple.
And there's this fantastic quote from health economist Stephen Duckett that just nails it. He says the focus becomes the patient, not the individual service. And that's it. That's the whole philosophy in a single sentence. You classify the patient's entire encounter, not just a shopping list of services. So, for the coders out there, the golden rule is pretty clear. Think like the patient. What was the main reason for the visit? Code for that predominant activity. And if it's a team effort, use the special indicator. The big don't is trying to game the system. Don't slice and dice one patient visit into several different events just to get paid more. That completely undermines the whole point.
Okay, let's wrap up by looking ahead. This is obviously a monumental change. So how exactly is it all going to happen without causing total chaos?
The good news is they're not just flipping a switch one day. The rollout is really smart. It's being done in careful phases. First up is shadow classification, which is basically a practice round. Everyone gets to use the new ADOC codes, but with no financial consequences. It's like a dress rehearsal. Then comes shadow billing to make sure all the IT and finance systems can handle the new data. The goal is to get all the kinks worked out before it actually goes live, and payments depend on it.
And that really brings us to the ultimate question, doesn't it? The one that hangs over this entire reform. On paper, ADOC is ambitious, it's patient-centric, and it's designed to solve a very real, very expensive problem. But will it truly deliver on its promise of better value for patients and a more sustainable system for Abu Dhabi's future? The blueprint is there, the logic is sound, but now the real work begins. Thanks for joining me for this Explain.